Yes, you know what? This is a tough time for everybody, all the Canadians, and everywhere in the world. You think, look at it, and they're all talking about only one topic, which is COVID-19 or coronavirus. And of course, if you are a deputy prime minister, deputy prime premier, and
The health
health
minister.
minister, Christine Elliott, you are the most busiest person in her portfolio. But I really appreciate it. I thank her so much that she has given us the time to talk to all our listeners. And Minister, I just want to let you know before I thank you for coming over that 770 AM is one of the largest ethnic radio stations in North America, and all the producers here together. What they are doing, we'll let you know in 1 minute time. But we have four producers right here, right now with me. Jagdish Grewal, very well-known personality, Jagraj Sidhu, Kulvinder Sheena, and Rana Sidhu. These four producers are with me right now, and I'm Abdul Majid. I'm one of the producers too. So what we are doing, we'll let you know later. But this time, I'm very proud to be a Canadian. Municipal, you take it municipalities, provincial, federal, all three level of governments are doing their best to fight against this. And before I go any further and pass my mic to other producers, what is the update and how can we calm the ordinary person, Minister? Before I do that, I like to again appreciate it and thank you so much for being with us.
Well, thank you very much. It is a pleasure to join you all today. And I think it's important, first of all, to deal with the virus and to let people know that we are all working together, federal government, provincial government, and the public health authorities in Ontario to keep Ontarians safe and healthy. I can also tell you that there was just a session here at the Legislature of Ontario where all four parties, including the Green Party, got together and passed a labor bill that would protect workers' jobs in the event that they become ill themselves with COVID-19 and have to self-isolate for 14 days, or if they have child care issues, if a child gets ill, or if they aren't able to attend daycare or school, that people won't lose their jobs if they need to stay home and care for them. So I think that really shows the level of cooperation, even amongst the various political parties here at Queen's Park. I can also tell you that we have a very active and strong plan that we are putting into place at the Ministry of Health, working with other ministries to increase our resources and to step up the plan as we see coronavirus, COVID-19, escalate. So we have resources in place now, and we will have resources in place in the future should the situation become worse than it is now.
Minister, what about the testing? I heard that we are talking about 5,000 tests a day. We are going to increase it. And looking at different part of the world, the way they control it is testing more and more people. Are we going towards that?
We are actively increasing our number of testing assessment centers, as well as our lab capabilities to read those tests. We are aiming to deal with 5,000 cases per day, and that is something that we are increasing because we have increased the number of assessment centers to 27, and they are outside of hospital emergency departments because we know that there are many people who become ill with things other than COVID-19 that need to be seen in the centers, and we don't want to expose them to the possibility of contracting COVID-19. In addition to the test centers, some of which have drive-through capabilities, we are also increasing the number of labs that are able to test the sample. We originally only had one lab testing facility. We now have several. spaced out of our large hospitals, and we are looking at adding more to deal with the increasing number of tests being conducted.
So right now we have, as we know, there's 4 days before we get the results. So are we working on shortening that time, because 4 days is a little bit too long to wait, right?
Yes, absolutely. 4 days is too long to wait, and we are looking at narrowing that to something more like 24 hours to 48 hours maximum. Because I know that a lot of people are waiting for the test. They need to know if they have active COVID-19 or not. That will affect their ability to go out in public, to go back to work, all of those things. So we are definitely looking at shortening the time before a person receives the results of his or her test.
I thank you so much, and I have a couple of guys who are very anxiously waiting to talk to you. But as good citizens of Canada and this beautiful country, 770 AM is definitely playing his part, and our radio station is doing. Very well-known personality of Canada, Jagdish Grewal, is with me. First of all, he's going to let you know what 770 is doing, and then after that, he has some questions with you. Jagdish?
Thank you so much, Minister. First of all, I would like to. Thank you so much, Minister. First of all, I would like to say thanks to the Ontario government. You guys are working so hard and your team, outreach team, is working so hard that we are spreading your message, whatever the message we are getting from you. So here at the 770 AM, we start our programs in the morning from 7:30 till 7:30 in the evening. Now, all the hosts get together here, and we have set up a group to help all the people out there who are the needy people. Either they need help in the food, or they need help to take them to the hospital, or they need any professional help to let them know what your government has provided them with all the packages, or the federal governments or the municipal government has provided the package, how they can get the help, so no one can left over in this in the hard time here. So that's what we are doing here from 770 AM. We started it yesterday. We got over 100 volunteers to provide food to the needy people and to help them in any way we can. We have all the professionals in our group, like taking care of all the hygienic system and everything. So this is what the 770 AM team is doing.
Well, thank you very much. We're very proud of you for the work that you're doing. It's so helpful to so many people. So our thanks and congratulations.
All right. Minister, since yesterday you are coming up with the comprehensive plan to end hallway healthcare. When it comes to the healthcare, yes, we understand that you guys are increasing number of the doctors, nurses, and everything, and providing more sources and more tools to them. But one question that always remained in question, that was ending healthcare. Hallway healthcare. Since yesterday, you said that you have a comprehensive plan to end that hallway healthcare, to increase the number of the beds. Is it going to apply to all the hospitals, and is it possible to end the hallway healthcare?
Well, yes, it is possible to end hallway healthcare. This isn't a problem that just grew up overnight. This grew for a number of years. And we are dealing with it since we were elected. That was one of our primary commitments to the people of Ontario. There's no one simple answer to ending hallway health care. A lot of it has to do with moving people who are called alternate level of care patients in hospitals, out of hospitals into long-term care homes. So we need to build more long-term care homes or have more spaces. We need to make sure that we can help people that have chronic mental health and or addiction problems, because many of them are not getting the help that they need in the community, and so they end up in our hospital emergency departments on a very frequent basis. And there's a number of people that are dealing with chronic health conditions that they may not be receiving assistance for in the community, and they end up in hospital emergency departments. So we are trying to deal with all of that. But right now, of course, our priority is finding space in our hospitals for patients who may have contracted COVID-19. But we're not moving away from our stated goal. We're going to continue to work on that, but we have to turn our attention to the biggest priority right now.
Minister Nether, there's a big problem is coming up in the community. That is the international students there. We just heard from one of my friends that all the colleges, like Belleville colleges, has given them an ultimatum that in so many hours you got to release all the
from dorm.
Residents at the college there. So where they gonna go? The international students, they don't have the families here. They don't know where to go, where to live. How are we going to handle this situation which is coming up at the hundreds of thousands of international students who are living here, who are living in all the college and university residences?
I'm sorry, do you mean in terms of in COVID-19 or just generally speaking?
No, because of COVID-19, all the residents of, the dorms I'm talking about, they are living in colleges and universities, and if they are asked to leave, is there a plan for them to set aside?
Well, we have a number of plans in place. First of all, we want to make sure that people have places to live, and so we're not going to be evicting people if they're not able to pay their rent right now, if they've lost a job, or if they're students and they're coming to the end of their school year. We want to make sure that people don't become homeless, and we want to make sure that people can be fed as well. So we're working with a number of grocery chains, a number of food banks, and so on, so that if people are having trouble and getting access to food, that we will be able to help working with our partners. So if people can be in touch with us through either their local public health units, which is probably the best place, on our website, ontario.ca/coronavirus, we can then get them the help that they need.
Appreciate it. And I have Rana Sidhu. Very quickly, we're going to let you go. I know you're busy. Rana ji,
yes, just one small question. So those businesses who completely shut off and they can't even pay the rent. So there's any plan for those small businesses?
Yes, we are very concerned about a number of businesses. I would say particularly small businesses that are very hard hit. They may have employees who are sick right now because of COVID-19. They may not be able to sell whatever it is that they're selling in terms of goods or services. We know that the economy of the province is being hit very hard by this. And so the federal government came out with a package this morning, billions of dollars to help individuals and businesses. We are just reviewing that package right now, and then we will be doing our part provincially as well to fill in any gaps to make sure that we don't leave anyone behind.
Thank you very much.
Minister, I know you are, like I said before the start of the show, that you are the most busiest person on earth right now. I thank you so much for giving us so much time, and hopefully we'll get to talk to you again.
My pleasure. Thank you so much for having me join you today.
Thank you so much.
बहुत धन्यवाद जी। और इस डिप्टी ਹੈਲਥ ਮਿਨਿਸਟਰ ਆਫ ਅੰਟਾਰੀਓ ਕ੍ਰਿਸਟੀਨ ਐਲੀਅਟ। ਔਰ ਦੋਸਤੋ, ਜਿਵੇਂ ਕਿਉਂਕਿ ਹੁਣ ਸਮਾਂ ਤਕਰੀਬਨ ਸਮਾਪਤ ਹੈ ਜੀ, ਸੋ ਅਸੀਂ ਪੰਜਾਬੀ ਫੂਡ ਸੇਵਾ ਦੇ ਬਾਰੇ ਇੱਕ ਵਾਰੀ ਫਿਰ ਰਿਮਾਈਂਡ ਕਰਾਉਣਾ ਚਾਹੁੰਦੇ ਹਾਂ ਕਿ ਤੁਸੀਂ ਉਹਦਾ ਹਿੱਸਾ ਬਣਨਾ ਚਾਹੁੰਦੇ ਹੋ, ਤੁਸੀਂ ਫੂਡ ਉੱਥੇ ਡੋਨੇਟ ਕਰਨਾ ਚਾਹੁੰਦੇ ਹੋ, ਜਾਂ ਫਿਰ ਤੁਸੀਂ ਆਪਣੇ ਤੌਰ ਦੇ ਉੱਪਰ ਲੋੜਵੰਦਾਂ ਨੂੰ ਫੂਡ ਅੱਗੇ ਪਹੁੰਚਾਉਣਾ ਚਾਹੁੰਦੇ ਹੋ, ਤੇ ਸਾਡੇ ਨਾਲ ਸੰਪਰਕ ਕੀਤਾ ਜਾ ਸਕਦਾ ਹੈ। ਜੁਗਰਾਜ ਜੀ, ਇੱਕ ਵਾਰੀ ਫਿਰ ਆਪਣੀ ਜ਼ੁਬਾਨੀ ਥੋੜ੍ਹੀਆਂ ਲੋਕੇਸ਼ਨਸ ਦੱਸ ਦਿਓ ਜੀ, ਫਿਰ ਆਪਾਂ ਜਾ ਚਲੀਏ ਜੀ।
ਜੀ ਹਾਂ, ਅਸੀਂ ਦੱਸ ਦਈਏ ਕਿ ਪੰਜਾਬੀ ਫੂਡ ਸੇਵਾ, ਅਗਰ ਜੇ ਕਿਸੇ ਨੇ ਵੀ ਭੈਣ ਭਰਾ ਨੇ ਉਹਨਾਂ ਦੇ ਕੋਲ ਆਟਾ, ਦਾਲ ਜਾਂ ਫਿਰ ਦੁੱਧ, ਘਿਓ, ਤੁਸੀਂ ਐਕਸਟਰਾ ਤੁਹਾਡੇ ਕੋਲ ਪਿਆ ਹੈ, ਕਿਉਂਕਿ ਇਸ ਟਾਈਮ ਲੋੜ ਆ ਭਾਈਚਾਰੇ ਦੇ ਨਾਲ ਖੜਨ ਦੀ ਜੀ। ਅਗਰ ਤੁਹਾਡੇ ਘਰ ਗਰਾਜ ਦੇ ਵਿੱਚ ਕੋਈ ਐਕਸਟਰਾ ਚੀਜ਼ ਪਈ ਆ ਤੁਸੀਂ ਲਿਆ ਸਕਦੇ ਆ ਤਾਂ ਕਿ ਲੋੜਵੰਦ ਪਰਿਵਾਰ ਦੇ ਨੂੰ ਦਿੱਤਾ ਜਾਵੇ, ਕਿਉਂਕਿ ਫੂਡ ਦੀ ਚੇਨ ਜਿਹੜੀ ਬਹੁਤ ਵੱਡੀ ਆ ਕੈਨੇਡਾ ਦੀ, ਕਿਉਂਕਿ ਮਿਨਿਸਟਰ ਨਵਦੀਪ ਬੈਂਸ ਜੀ ਨੇ ਵੀ ਸਾਰੇ ਰੇਡੀਓ ਤੇ ਆ ਕੇ ਦੱਸਿਆ ਕਿ ਘਬਰਾਓ ਨਾ, ਨਾਰਮਲ ਹੋ ਜਾਣਾ 1-2 ਦਿਨਾਂ ਦੇ ਵਿੱਚ, ਬਟ ਫਿਰ ਵੀ ਸਾਡੇ ਜਿਹੜਾ 770 ਦੀ ਟੀਮ ਵੱਲੋਂ ਇੱਕ ਉਪਰਾਲਾ ਕੀਤਾ ਗਿਆ, ਉਹਦੇ ਵਿੱਚ ਅਸੀਂ ਦੱਸ ਦਈਏ ਕਿ 5 ਸਟੈਡਲੀ ਸਟਰੀਟ ਤੇ ਤੁਸੀਂ ਡੈਰੀ ਐਂਡ ਏਅਰਪੋਰਟ ਦੇ ਏਰੀਏ 'ਚ ਉੱਥੇ ਤੁਸੀਂ ਡਰੋਪ ਕਰ ਸਕਦੇ ਆ ਜਾਂ ਫਿਰ ਉੱਥੋਂ ਲਿਜਾ ਵੀ ਸਕਦੇ ਆ, ਕਿਉਂਕਿ ਸਾਡੇ ਕੋਲ ਬਹੁਤ ਸਾਰਾ ਸਮਾਨ ਜਿਹੜਾ ਐਕਸਟਰਾ ਉੱਥੇ ਆ। ਔਰ ਨਾਲ ਦੀ ਨਾਲ 2 ਮੈਲੀ ਡਰਾਈਵ ਤੇ ਜੀ ਜੀ, ਔਰ 416 302 3600 ਨੰਬਰ ਆ, ਉਹਦੇ ਤੇ ਟੈਕਸਟ ਮੈਸੇਜ ਕਰਕੇ ਤੁਸੀਂ ਮੈਸੇਜ ਭੇਜ ਸਕਦੇ ਆ ਕਿ ਫਲਾਣੇ ਥਾਂ ਸਾਨੂੰ ਕੋਈ ਚੀਜ਼ ਦੀ ਲੋੜ ਹੈ।
ਬਿਲਕੁਲ ਜੀ, ਬਹੁਤ ਬਹੁਤ ਧੰਨਵਾਦ ਜੀ ਜਗਦੀਸ਼ ਜੀ, ਕੁਲਵਿੰਦਰ ਜੀ, ਜਗਰਾਜ ਜੀ, ਤੁਹਾਡਾ ਬਹੁਤ ਬਹੁਤ ਧੰਨਵਾਦ।
ਥੈਂਕ ਯੂ ਸੋ ਮਚ। ਔਰ ਇੱਕ ਵਾਰੀ ਫਿਰ 770 ਦੀ ਜਿਹੜੀ ਸਾਰੀ ਟੀਮ ਉਹਦੀ ਯੂਨਿਟੀ, ਜਿਹਦੇ ਵਿੱਚ ਸਵੇਰ ਤੋਂ ਕੁਲਵਿੰਦਰ ਸ਼ੀਨਾ ਜੀ, ਉਸ ਤੋਂ ਬਾਅਦ ਸਾਡੀ ਖਬਰਸਾਰ ਦੀ ਵਾਰੀ ਆਉਂਦੀ ਹੈ, ਉਸ ਤੋਂ ਬਾਅਦ ਮਹਿਕ ਰੇਡੀਓ ਆਉਂਦਾ, ਉਸ ਤੋਂ ਬਾਅਦ ਰੌਣਕ ਪੰਜਾਬ ਦੀ ਆਉਂਦੀ ਹੈ, ਉਸ ਤੋਂ ਬਾਅਦ ਸਰਦਾਰੀ ਤੇ ਉਸ ਤੋਂ ਬਾਅਦ ਸਾਜ਼-ਓ-ਆਵਾਜ਼। ਸੋ 770 ਦੀ ਜਿਹੜੀ ਟੀਮ ਇੱਕ ਸਟਰੋਂਗ ਇਕੱਠੀ ਕਮਿਊਨਿਟੀ ਦੀ ਇਸ ਮੁਸ਼ਕਲ ਘੜੀ ਦੇ ਵਿੱਚ ਇਕੱਠੇ ਹੋ ਕੇ ਨਾਲ ਖੜੇ ਆ ਸਾਰੇ।
ਸੋ ਲੱਗੀ ਆ ਜੀ
ਜੀ
ਗਲਤ ਬੋਲਿਆ ਗਿਆ ਤਾਂ ਮਾਫੀ, ਅਗਲੀ ਮੁਲਾਕਾਤ ਤੱਕ ਰੱਬ ਰਾਖਾ ਜੀ।